the first question, sort of the big picture question that maybe you can, in part, and others, you know, you all might be able to answer in your own ways. How is Boston and Massachusetts doing by comparison to other states? You know, there's a lot. I mean, there's a lot going on. It seems. How are we doing? And maybe extend on that. What more? I mean, not what. I'll leave that one for later on. You know, how are we doing? And there's a microphone there, so you can sort of pass it around. Everyone take it.
The thing is, I wonder if Liz wants to do this one first because
speak to the mics and then Liz, go ahead. Yeah.
Well, I mean, I think that the fact that there's kind of a commitment from the city to be thinking about this is a sign that we're doing decently well. I also think, to your point, Chris, I mean, there's so many groups in Boston who are thinking about food insecurity. Like, it seems to me that everybody is, like, every food group is thinking about it from a different angle. So there are people thinking about it from the urban agriculture perspective. There are people thinking about it from the kind of healthy eating, active living perspective. So, I mean, I think with respect to buy-in, we're doing really well, for sure.
Right. But you're sort of intimating that there might be a problem with so many groups doing so many different things that questions of impact or questions of duplication of effort.
Yeah, and I think even more importantly, like misconnections. So I think that. And duplicative effort, yeah. I think that everybody's competing for the same funding, and maybe they should be trying to apply for that funding together. And you know, everybody's got sort of like their niche that they fill, and maybe they should be combining forces. But I think that there's a lot of buy-in and a lot of effort. So I do think that that's really positive for sure.
Anybody else want to comment on that larger question? How are we doing? Mike?
So you can tell I was vaguely trying to dodge this one. That's
why I was asking. That's why I wanted you to comment.
In fact, because some of the statistics I know best, like national data series on household food insecurity measurement, are not available at the municipal level. So it's something that you should know about the strengths and weaknesses of different ways of measuring hardship. If you think about a household food security measure, it tends to be hard to compare municipality to municipality. You can compare states to states, but hard to do city to city. Whereas poverty measures really are available in the American Community Survey down to a fairly disaggregated level. So you can tell, so how is Boston doing? On big economic questions of economic hardship and poverty, Boston has higher than average income relative to the U.S. as a whole, but it also has higher housing prices. And so you'll find in Boston some peculiar problems, some peculiar advantages. And maybe I'll say on average, each place in the country is struggling in its own way, and Boston is probably no better or worse than anywhere else.
Fair enough. Anybody else want to comment on that? Yeah. Good.
Can you hear me? Okay, great. I think one of the other areas too that needs to be looked at is looking at food access and other health issues and disparities by race. If you just particularly in Boston, and I'm not going to get the numbers right or pretend to be able to quote them, but just between neighborhoods, there's huge disparities between even, how long people live, what's the life expectancy. And I think there's so many areas within Massachusetts and municipalities and in rural areas where communities of color are really lacking in resources. And, Liz talked about redlining, and I think that's definitely an area, that we're still not doing well in. The disparities have to do with race and have to do with equity, and I think that's definitely a lens that we should be taking when we're doing this work, and it's certainly something we're talking about and trying to think about and incorporate more in our work, in all our policy work with the Mass Public Health Association, because I think it's just really crucial to the conversation and to achieving real equity and positive health outcomes.
Okay, so open it up for questions.
My concern, probably everybody else's, is that going forward, new administration, during the nomination process, there's been very, very little said about food, insecurity of food, and a lot of, they talk about poverty and use the word poverty without any definition of what it is. is there any feel for where we may go, or what have we done, we'll say over the last 5 years? Has there been a decrease in food subsidies from the United States government? And going forward, what are the problems if they are cut, and what do we have to do to compensate for it?
That's my part.
So I tend to be very bad at prognosticating political things in the future because I tend to be an optimist. Like I tend to look at the situation, think through what ought to be done, and I think, oh, surely these very smart people who are at the top of their game and have made it into the national legislature are going to agree on this. And then I get endlessly surprised. To me, it seems so clear that for the incoming administration, that the politically sensible thing to do would be to pick its fight. It comes in with a fairly conservative constituency that backed it, fairly angry, a number of things that were promised, and cutting food stamps was not one of them. And so if it were up to me and I were anybody on the staff, I would say, well, I don't think you can get out of building a wall, and I don't think you can get out of trying to, defeat Obamacare, but don't pick any more fights beyond that because things are going to fall apart. And every signal in the new administration is that they seem to be pursuing all of these struggles at the same time. That they seem to have the stomach for, at the same time, trying to cut pretty much every aspect of the social safety net simultaneously. And I've never seen that work. And so I'm sort of flummoxed what happens next. And the support is not there even on the Republican side of the Congress to do all of this at once. And so it just seems like unusual times.
I can add just, so I think maybe I'm less optimistic, and we think a lot, like in groups, and Christina's been in meetings where everybody is nearly in tears thinking about the idea that SNAP could be block granted and how devastating that would be if that happened, and how many people would lose or have significantly reduced SNAP benefits. And that's really scary from my vantage point because, like, in my mind, addressing SNAP access is sort of like the low-hanging fruit in some ways, because when you say how is Massachusetts doing, with respect to SNAP, I think we're doing really well. There's really great advocates who are really good at making SNAP as accessible as they possibly can in Massachusetts, and so, like, there is a SNAP gap that exists, but, like, I think we're in much better shape than a lot of states, and so the idea of being able to sort of just close that gap and give more supports to people who need SNAP and make it easier for them to apply and make them understand the process better or something, in some ways feels almost like low-hanging fruit. And so if it gets block granted, then it's like really high-hanging fruit, and it's really hard to know where to start with that. And I think, yeah, so that's not very optimistic, I'm sorry.
Let me just add quickly a couple of points. And remember, SNAP is implemented through the states. So there's already some variation from state to state. So the really interesting question is, if they went to a block grant, you may see perhaps even greater variation state to state. It would be an interesting question to see how a state like Massachusetts would handle it. The echo on Park's thing, I just want to comment. What strikes me is that, and he made a point about a lot of conservatives. There's a lot of Republicans, a lot of conservatives who aren't necessarily in favor of reducing or block granting SNAP for other reasons. The point, SNAP is also roughly about $72 billion a year now. That's $72 billion a year in subsidies essentially for agricultural and food sectors. In a sense, because the substitution effects, if you took away that money, would it be replaced by other money? The answer is probably no. So it actually would be a real cut in essentially subsidizing purchases in the food system. Retailers would fight it, producers would fight it, processors would fight it. So in an odd way, it's an odd coalition of support. Nutrition advocates plus farmers, food sector advocates, Walmart, largest retailer of food in the country, also probably the largest SNAP. We don't have those data well, USDA does, but they don't release it, of largest redeemer of SNAP in the country, probably. So, you know, it'd be an interesting, odd coalition of support. I think Conaway's point as Ag Chair was, the House Ag Committee is probably not likely. Now, whether the rest of the Republican House in particular, they're the ones, not so much the Ag folks, but the other Republicans. So the fight's going to be among Republicans.
Did you say 72 billion?
72 billion a year.
For what?
SNAP.
Where?
Well, that's the national right now, roughly about 72 billion, because it's an entitlement program, so it goes up with, and then goes down, so it's going down again, but it went up during the Great Recession. So you know, that's why it was a big target in the last Farm Bill. Yeah, go ahead.
Does everyone know what an entitlement program is versus what a block grant would do? I feel like that's an important distinction.
Yeah.
So SNAP right now is an entitlement program, which means anyone who is eligible for benefits and needs those benefits will get them. But if SNAP is block granted, there'll be a set amount of money given for SNAP, and then the state will have to distribute. So if you come in down the line and you need SNAP benefits and you're eligible, but there's no more funds left, then you won't receive those benefits. So that's why we see it as a big concern, because it will potentially limit the number of benefits going out to individuals and families.
Mark, you want to add to that?
Just on the numbers, you know, at $72 billion, nobody in this room probably is very good at sort of gauging prices of things that are in the tens of billions of dollars. So SNAP is the largest program in the U.S. Department of Agriculture, and it still, even at that, amounts to about 1.5% of the federal budget. And if you think about trends, the trend in SNAP spending is going down, even with no change in budget, because poverty is going down at the stage that we currently are in an economic expansion. So as more people are employed in the most recent years, the number of people participating in the SNAP program has already started to fall, and the trend in Congressional Budget Office projections, even with no policy changes, for continued falls. You contrast that with the trends expected in Medicaid, where Medicaid is a much more expensive program than the SNAP program, and the trend is completely upwards just because our healthcare costs have been increasing at such a rapid rate year after year. And you put those two things together and you think that maybe SNAP is the comparatively good deal from a federal budget perspective. In fact, if we can keep people healthier, it might even be a good deal in terms of Medicaid costs. And so the billions of dollars is big, but in a sense, not as big as you might think.
Okay, go ahead.
Question for Alana, a tactical question and perhaps even a behavioral economics question about, you mentioned removing stigma with the family program. How do we think about the high school program and removing the stigma there? Do I have to qualify to walk into the food pantry and participate, or am I welcome in as any student? How does it work?
So how it works is the food pantry is actually right next to the principal's office. You access the office and speak to one of the clerks and say, I need to be taken back. It's very discreet. It's way back in the back of the office. And then the clerk walks through with them and makes sure that they understand, what items that they can take. Sometimes if they're first-time kids, they don't know what to take home. So no, there's no stigma in terms of that. And then it's nice because it's right next to the principal's office, and he can walk in and say, hey, how's it going? And then be aware of which kids are really accessing the program. Did I answer your question?
Yes.
Yeah. Were the schools sort of surprised were people surprised at how many kids and families in Cambridge, or did they have a sense that there was this potential scope of need?
I think definitely, especially based on the numbers that we had in the backpack program of the elementary and upper school kids, I don't think anyone was surprised that there was a need at the high school.
Mm-hmm.
It's taken a while. It's been almost a year. It's taken a while to get the kids to really understand that it's there and how to go, and but it's really being accessed really well right now, which is wonderful.
And I know you call it a food market, but you don't charge anything.
No, we don't charge anything.
So you don't use the term food pantry.
No, we tried using the word food pantry and no one came.
Yeah. So it goes to stigma again. Right. We call it a market.
We call it a market and everyone can come, people come.
Yeah. But it's an interesting point about, in the behavioral dimension of framing. Okay, over there, where's the next, go over there? No.
Just to continue.
No, let her go first, then you go, okay, yeah. Go ahead. Is it on? Yeah.
Hello, my question really is about cooking. I understand when you're hungry, a sugary drink and fried food is much more appealing and it's probably immediately satisfying than taking fresh vegetables and cooking something. But I also understand that this is a problem, that a lot of people don't know what to do with fresh food. And do any of your programs deal with that, or can you comment on that?
I can speak to our programs. So today at the market, I know what we're getting ahead of time, and I put together a couple of recipes, and I make sure that they're available. And the same thing happens with our home delivery program. And actually, we had an intern over the summer that put together recipes that live in our high school food pantry, just to make sure that there's some simple recipes, especially for high school students who aren't used to cooking.
Thank you.
Can I follow up on that? How many of these kids are going home to family situations where perhaps no one's cooking?
Right, so with the weekend backpack program, we make sure it's sandwiches or microwavable items so that, if kids are going home and if there isn't a parent at home, they can easily be made.
With your monthly markets, how did you initially get people aware of them going on? Like, how did you actually reach out to the families and kind of tell them what was happening?
Yeah, so in Cambridge, we have a staff position called a family liaison in every single school. And so that staff position is really to reach out to families via, backpacks. We have a specific backpack express where flyers can go home. There's an email, they put up flyers all over the school, and really it was about word of mouth. So the family liaisons know in the school, who's accessing the backpack program or is hungry. And so they reached out to those families and told them that the market was happening. But it really was sort of a word of mouth.
Go ahead.
Two brief questions. Does anybody know whether pediatricians, the focus is on food insecurity for preschool children. Does anybody know whether pediatricians, as part of a normal assessment of a child, inquire as to make a judgment as to whether the child is being adequately fed or not? And is there any mechanism for referrals to be made? It's not a form of abuse. I mean, I'm not suggesting that, that parents be called on the carpet, but so, that's the general question. And then the bigger question is, to what extent are major philanthropists in the United States focused on or helping address the issue of food insecurity the way they help so many other issues at scale?
I can speak to your first question. I know in Cambridge the pediatricians are doing a pilot right now where they screen for hunger, and there are 3 questions that they ask. And if they screen positive for hunger, they are referred out to Project Bread. So they're given a piece of paper with the hotline number, and they are sent home. There's your referral. I think that they've been surprised at how many families are actually reporting that they're food insecure.
To add to that, I don't know if this is the screening they're using, but there's something called the Hunger Vitals sign, which was developed by Children's Health Watch, and it's exactly what you just described. Some people use something similar, they don't call it that. But I was just in a meeting today with the Boston Public Health Commission and the Greater Boston Food Bank. The Greater Boston Food Bank is piloting something similar where they're linking community health centers with, they're doing the Hunger Vital sign in the community health centers and then making referrals to pantries that are partners with the Greater Boston Food Bank. And the Boston Public Health Commission really cares about making the Hunger Vital sign something that is more universally used, because it's really easy to work into. The primary care physician would just ask the 3 questions, and then they would have the information and potentially even have it incorporated into the electronic medical records, and it could be really valuable. And the Boston Public Health Commission developed a tool, which of course now I can't think of what it's called. It's a new website. Too bad that I can't think of what it's called. But it's a new website where they have all sorts of health resources and social resources available. And it's an app. If you Googled it, I'm sure you'd find it, Boston Public Health Commission app or something. And so they would love to see the Hunger Vital sign get instituted and then use this new app to link people up with social services in their area, which could include food pantries or backpack program or whatever. regarding philanthropy, all I can say is that I know a lot of funders are starting to think that food is, like, I think it's sort of like a sexy topic, you know, there's a lot of, I'm seeing a lot of grants coming out that have like food insecurity, food access, and whether or not the metrics that they want you to measure are valuable, I can't speak to that.
Christina, what are you saying from the state level?
Sure.
So I also had a conversation with the Greater Boston Food Bank, and so as I mentioned before, the MPHA, every 2 years, we go out and talk to a number of our partners statewide to hear about what's happening on the ground, what are the issues in their community, so we can really link it to the policies that we're going to work on that will impact, you know, communities across the state. And one of the areas that came up in several of my conversations was these food insecurity screenings. And I'm not committing publicly to anything, but I think this is something MPHA definitely wants to look into and maybe convene on, because it's an issue we've heard all across the state, working with several different food banks, and how do we make, you know, how do we implement these screenings within the clinical setting, but more importantly, how do we then link these families and individuals to the services, because giving them a cold handoff, as we call it, and just saying, oh, there's this food pantry, you could go there for some help, you know, really doesn't make that connection. So some of our other programs or policies that we advocate for and have helped get implemented involve community health workers who are able to serve in that clinical setting and then be that warm handoff that can follow up with individuals or families, connect them to the services that they need. And even, I think the Greater Boston Food Bank is providing a mobile food pantry at these different clinic sites that they're piloting. So it's not just that the people have to go elsewhere. If you come in for your, you know, services on a Thursday, you know that the food pantry is going to be there and you can go access that as well. But I definitely think it's an issue that's come up a lot and that we want to address. And on the philanthropy side, just I know a lot of the large foundations are really interested in food work. When I was working in southern New Mexico, almost all of our work was funded by the Kellogg Foundation. They were really interested in that. And then right now, the American Heart Association and the Robert Wood Johnson Foundation have joined together to create what they call Voices for Healthy Kids. And they're funding campaigns similar to our Mass Food Trust campaign all across the U.S. among a number of different policy areas. So there's a lot of interest, I think.
Hi. This question is for Liz and Christina first, and then the others too. But I work in a health center in Jamaica Plain, and we get feedback from a lot of patients around in terms of what they want their doctors and nutritionists to know about access to food. And a lot of the comments have been, there is very little access to healthy food in my neighborhood. And from general perspective, there's also the opinion that there seems to be a lot of access to healthy food. I'm thinking specifically of a Stop and Shop supermarket or that kind of thing. So I'm wondering if you've come across this kind of disconnect where there seems to be real access to somewhat affordable, healthy food, but then a misperception around, you know, whether that is really accessible to people or not. Do you understand what I'm asking?
Yep. So I've already heard those concerns in the listening sessions we've done, and I think it's been eye-opening for me as well. So Jamaica Plain is a perfect example. There used to be a store, Hilo, I think, and it was replaced with a Whole Foods, which was really a big deal because it really impacted affordability of access to healthy food. However, you know, the thought is, well, there's a Stop and Shop just down the street. But what I'm hearing from our participants in these listening sessions is that Stop and Shop isn't affordable. Because when they're living on a fixed income, it's rare that they can find affordable produce, period. Like affordable, healthy food. The processed stuff is always so much cheaper, and you can always get so much more. And even if it's not as wholesome and nutritious, it's really difficult when you're on a fixed income to justify buying significantly less food if it's healthier. So it's tricky because it's sort of, from my perspective, how do you know, there's like these food subsidies that make the cheap junk food cheap, and there's not those same subsidies for fruit and vegetables. Like, what can our office do about that? I don't know, that's like a big thing, but.
So my second this because I know that Stop and Shop very well, and just when I think about the produce prices, they're very, you know, this is my opinion, of course, but I tend to look at this stuff a lot. They're fairly low cost. So it's, the next thought I have is what's going on with the perceptions there? I'm thinking of the entire produce area. And so I'm wondering if your groups are like digging into the data around actually, what the costs are at these stores and how affordable they really are versus perceptions around that.
So we haven't started digging into that data yet, but I mean, just from what I've heard, because I was sort of, as somebody who doesn't struggle with food insecurity, my thought is Stop and Shop seems affordable, but what I'm here, I've heard it in multiple places, it's not, is what I'm being told. It's just not. And, if you're dealing with, and now that makes sense, it makes sense, it's just not. If you're dealing with a food budget of, $200 a month for a family, that's not, it's not gonna work. And so that's what we're being told. And so that's something our office is starting to think about is like, what can we do to battle that? Because the perception of a lot of the people working on this food is like, oh yeah, Stop and Shop is there. Whole Foods isn't affordable, we know that, but Stop and Shop is there, but.
What about Market Basket?
Well, let me follow up on that. I mean, again, this gets to the point about, whether it's Market Basket or it's Stop and Shop, this notion that we solve the food desert problem because technically we have a grocery store within a mile of almost all the people in Boston, and yet this notion of perception or reality of the cost is an interesting question. Yeah, but go ahead. Add on to that. Go ahead. Anybody?
So I think some of the things that have already been brought up today too that we're looking at as well as we hear stories, and Mason Square in Springfield used to have a grocery store years and years ago, and now they don't. And there's families that have to take 2 buses just to get to the nearest grocery store. And so I think besides just price point and physical access, there's so many other barriers that are at play, including just physically transporting yourself and or your kids to a grocery store and having to then find affordable, fresh, healthy produce, right? And then getting it back to your house. Then we also talked about the cooking component. Not everyone knows what to do, with the foods that they know are healthy and they're supposed to be purchasing. And then there's a cultural component, right? Can they find the foods that they're familiar with and that they want to be eating at these different, retail locations as well. So I think, there's just so many different barriers that are in place. And then even, there's different ways to look at it. If you're in a city, is a mile really reasonable? Or does that mean you have access to that grocery store because it's within a mile? You probably don't have a car and you're not going to walk that distance carrying heavy bags. And so I think, there's just a number of different, points that you should be thinking about when we're talking about access. It's just a really loaded word, I think, in my opinion.
So I've got something to say on this question. That you can tell I'm squirming a little because it might be a little off message, but hear me out for just a second. Sometimes we expect too much from a particular food retail location decision. We expect it to solve certain types of problems that are beyond what that particular decision can solve. So for example, you could have households that will say, I can't afford the fruits and vegetables in my neighborhood because their incomes are too low. Right? It's very hard to provide fruits and vegetables at such a price that somebody whose income is not adequate is going to be able to say that, oh yeah, for me, fruits and vegetables are affordable. You have to focus on what the real source of the problem is. And people's needs and their assets to achieve those needs are very diverse from person to person, which means it's hard to predict what exactly is the retail that each household needs. And so for one household, what they want is fresher fruits and vegetables, really the delightful fresh fruits and vegetables. But if you locate a Whole Foods in the same location, that might not meet the needs of other households whose key concern is affordability. And for a household whose key concern is affordability, they may prefer to travel a longer distance to the most price competitive supermarket and might do so even if there were a close supermarket in the neighborhood. And so you might fail to meet that household's needs by locating a new retailer in a particular neighborhood because that household is going to bypass the nearest retailer. So when you study the geography of how people actually access the retailers where they shop for food, there's some surprises, including the fact that people travel further on average than you might think. It's very common, both among low-income people, middle-income people, and high-income people alike, to bypass their nearest supermarket in order to get to the supermarket where they do most of their shopping. And once you start to think of that, you realize what the challenge is, how difficult it is to kind of predict what everybody's supermarket need is. And none of this means that the healthy food financing is a bad idea. It's more, this comment is more gentle than that. It just adds an extra screener that you have to pass your idea through before you're sure it's a good idea, including if we did locate a supermarket in this location, thinking honestly, not just about whether people report that they're having trouble buying fruits and vegetables, but would they actually shop at that supermarket? You have to have the same sort of self-reflective, desperate scrutiny that a business person would give looking at a particular proposal.
This question goes out, right? This question goes to anyone here. France has a law that makes it illegal for supermarkets to throw away food that is unsold. And to put this in perspective, in USA we have 40% of the food that just gets thrown out, and much of it is not past its expiration date. So do you think having such a law would help the food insecurity problem in USA? Or maybe the issue is not with the supply of food, but maybe with getting the food to the people, or maybe to address the issue of stigma. Is fixing the supply of food problem, is that the main way to solve this? Or?
So I can take a quick stab at this. I think it's an amazing law. Here in Massachusetts in 2014, there was an organic food waste ban that was passed. And what that did was any corporation, institution, organization, university that throws away over 2,000 pounds of food a week either has to compost it or donate it or pay a big fine. And so what that did was it really allowed food rescue here in Massachusetts to really ramp up. For example, when that happened, Harvard University was throwing away a ton of food every week. And because of that law, they had to stop. And what they did was they partnered with Food for Free, and we pick up all of the prepared foods from their 16 dining halls every single day. They freeze it at night, we pick it up in the morning, and then we repurpose that food. We send it out to soup kitchens, feeding programs, but we also repackage it into individual microwavable meals that we're actually able to give to people who live in motels who are homeless, who have no access to a kitchen. We are able to stock them at elementary schools in Cambridge and Somerville for people who are in crisis. So I think that the Massachusetts is also leading the way in the United States around food waste and food rescue, and it can absolutely make a huge impact on getting the food to food insecure people, and it's giving universities, corporations, and large retailers a real way to want to donate.
I just want to point out, by the way, we're going to do food waste on March 1st, so come on back in March 1st.
Hello. So I just wanted to address the comment about philanthropy. I work in philanthropy, and my foundation is part of a funders collaborative in Massachusetts. Okay. And so I just thought you would want to know that there is a group of funders in the state that really cares about, so it's called the Massachusetts Convergence, and they have chosen food access as their focus. So if you want to ask me more. But so they're kind of high level, trying to bring together, key players that can really influence policy change. So I just want to share that. But I do have a question about food security and data. Do you think that we have all the data that we need? What are the data gaps? And who can we rely on to provide the necessary data to really, know where the problems are and improve the system?
Go you first, and then
Just go.
Well, I mean, I think, I know one area where data is missing is in sort of in the healthcare field. I think that like if we could show more data coming out of health centers and doctors' offices about food insecurity, I think it would be a really strong argument for, you know, supporting the kind of work that we're doing. And I think that there are challenges with getting that kind of data into the like medical records that it can be used to, as in research. So I know that's one area that's lacking. I can't speak too much more except for my own inability to find data, but that's just because there's so much and I don't know what to pick from, but that's really just my problem.
That's great. It's great to hear the account of so much because it sort of gives me the courage to give the fairly optimistic comment I had about data availability, that even though I could list a lot of things I wish I knew in the data that I don't, really there's immense amounts of data being produced. And if I had to say what the shortcoming is, it's the ability to draw inference from it. And so there's lots of investments in data and not a lot of investment in research design, in sort of really pilot testing things that governments are trying or that even agencies are trying in a rigorous way. And so I'd say research design is the shortcoming, you know, really being able to tell cause and effect in changes that we're making. And actual data in terms of numbers is not the big shortcoming.
I'm familiar with some of the food pantry programs in the Lowell area. And one of the things that was very striking was that food insecurity increased over the course of a month, every month, because of when grants were given out, SSI, Social Security, etc. And so I wonder, are there any efforts to address that kind of situation that people face where they have money at the beginning of a month or at one point during a month because of being the recipients, and then over the course of the 30 days, you know, there's much less money available for food.
So I know that Project Bread has a program where they take folks into a grocery store and help them shop for food and plan and do recipe planning and meal planning. And I think that's the only program that I can think of that addresses that particular situation. I know we plan our food markets at the end of the month for our most high-risk schools, just for that reason.
I think too, this just, you know, points to the importance of incentive programs. And so, you know, the Boston Bounty Bucks and just being able to help people stretch their dollars, even if it's a little bit, it really goes a long way. And, you know, multiple people today have talked about HIP, which is the Healthy Incentives Program, which will, you know, at certain price points like farmers markets and CSAs and mobile markets, be able to, you know, put additional funds back onto SNAP recipients, you know, EBT cards so that they can stretch their dollars a little bit further. And I think just having programs like that go a long way.
I did my dissertation on this topic of the monthly, what was at the time, food stamp cycle, and that ages it a little. There is a boom and bust cycle in when people make their food purchases, and there's a milder but still noticeable cycle in when they actually consume food, where people are more likely to go hungry towards the end of the SNAP month. And one of the innovations when we were talking about research design that I actually had in mind is I'd be interested to see a pilot of split issuance where you deliver the benefits twice monthly instead of once monthly. And it tends not to have support even within the public interest community out of concern that it would be paternalistic or patronizing or would force people to shop twice a month when they might find it easier if they're lacking supermarket access to shop only once a month. So I'm sort of telling you what the downside is that I often hear, even though I feel certain that it's an interesting enough idea that I'd like to see it piloted. And if it turned out to be a bad idea, then people wouldn't have to do it. But among the concerns are, even for, first thing is there's hunger at the end of the month, but even for conditions like diabetes that are associated with high rates of overweight and obesity, the boom and bust cycle in food intake may be a particular concern. with regard to this being a patronizing or a paternalistic idea, I can't help but notice wage earners get their wages twice a month. So it seems to me that anything that puts the social safety net on a cycle that's more similar to how wage earners live their lives seems to me destigmatizing, at least potentially.
Sophie, and then.
You should say so. You should say so.
Okay.
Hi, thank you so much all for coming. I really enjoyed hearing all speak. I have two questions. The first one is, how is the problem of whether it's families or students who may be food insecure but are not on the radar, whether they don't qualify for free or reduced lunch, or whether it's they don't, I think it goes back to, I forget who was talking about it, but whether they aren't a citizen and they fall through the cracks in a sense. And then my second question is for Alana, and I was wondering how Food for Free is staffed.
Not a lot of us. So your first question is around accessibility for programs like the backpack program, and whether or not we don't use free and reduced lunch as a qualifier to access the backpack program for specifically the reason you cited, right? So there's a lot of immigrant families in Cambridge that would never put their information on a government form. That's right. And so that was sort of one of my first learning moments of this program. I was like, well, we'll just have people that access the free and reduced lunch. But the cafeteria managers in the schools, who are the ones who know which kids are hungry, were absolutely against that idea. So that's one of the ways we identify hungry kids is the cafeteria managers, because they know who comes back for more, they know who steals food. And then the teachers are also a really good indicator of who always hoards snacks, who hoards items in their classroom. And then your second question was around staffing. We have 5 full-time staff members, and then we have a number of part-time program coordinators that help us with our work, so they work 10 to 15 hours a week. And then we have 6 or 7 drivers that are on the road every single day.
How many volunteers?
Hundreds. Really? Hundreds, yeah. Thank you for asking that. We could not do the work that we do without them.
Thank you.
My question is also for Alana, because you talked about how you alone kind of went into the school and started the backpack program. So I'm wondering if you could talk a little bit about just that initiative, kind of the funding. It sounds like you got immediate support from the schools, but the actual financial part of getting it funded, and then also how you came to connect with Food for Free, and maybe some of the differences, or again, funding that you've seen. I think it's a great example of not siloing, and so that's why I'm curious about that part of it, because I think that maybe a lot of people have ideas of programs and things they might want to do, but hooking up with another group that's already doing something seems like a way to have more impact.
Okay, yeah. So when I wanted to start this program and I needed the money, I just asked every single person I knew, where do you think I could find the money for this program? And I ended up talking to my daughter's pediatrician. I don't know what other people do with their pediatricians, but I asked her how I could find the money for this program. And she actually said that their pediatrician's group has a foundation, and they had just had a golf tournament, and they were wondering what to do with the money. So it was very serendipitous, and actually they have been my #1 supporter and #1 proponent of this for years. And it's been a nice symbiotic relationship, because they'll see kids in their office scream for hunger and say, do you know about the backpack program? And they're able to send them to me right away, which was great. But after that initial funding, I reached out to Cambridge, the community, basically. So I asked people to sponsor a child for the school year. So I said it's $250 for one kid for 1 year, and a lot of people wanted to do that. I also reached out to the business community and to the schools in Cambridge. And funding is always really hard. I will share with you that the state actually funded the program last year and promised to fund it again this year, and then Charlie Baker and his 9C cuts in December actually pulled all of our funding. And it was a retroactive funding cut because our first invoice to the state, we had spent all this money, the first invoice to the state was actually supposed to go on December 15th, and he cut the funding on the 6th. So he cut all of my funding for the entire year. So we spent a month, 6 weeks scrambling, calling on the Cambridge business community, the citizens, the city of Cambridge, and I'm happy to report that we are fully funded for the program again. Now, I think that that is going to become the norm going forward. There are going to be a lot of funding gaps, and that's going to be really hard. But in terms of if you have a great idea and you are looking for funding, just ask every single person that you know how to connect to the money.
That's $18.5 million in pay raises these people are about to give themselves, including Charles Baker. Remember this, $18.5 million, and this is what they're cutting.
Sorry, just about kind of connecting with Food for Free.
Oh, sorry. So yeah, so when I started the program, I had reached out to Food for Free, and they had always provided our fresh fruit. So in the beginning, they were providing me 30 pieces of fresh fruit every Friday, and then it ramped up to, now they're providing 1,000. And I never wanted to be my own nonprofit. I had a job, I have a family. I think that there's a lot of food access work, really good organizations that are doing this work that have the organization and the structure. And so when it got to be really big and we got the state money, I went to Food for Free and said, can you please adopt me and make sure that this program is viable in the future. I mean, what if something happened to me or if I moved or any number of things, so.
Was that about a year?
Yeah.
Just a quick question was asked, how much was the funding that got cut?
110,000.
Right. So it was not trivial, so, okay. We reached our time. Let me just make a concluding comment. What struck me, and there's a lot of things that struck me about these conversations today, but one thing that struck me in comparison to our, 2 weeks ago we started this and we talked about, for most of us, the food system gives us what we want when we want it. That's an individual construct. What strikes me here is that dealing with issues of the dilemmas, problems, challenges of food security for all is not an individual, it's a community problem. Notice the number of actors: pediatricians, teachers, cafeteria managers, people at the front lines, health service workers. It really does strike you that, in the wealthiest country on earth, the gaps are gaps oftentimes of the people we don't see. And so how do we figure them out, and how do we address these gaps is the great challenge of the moral society, one would hope. So with that, I'd like to thank our guests for what I thought was a really great presentation. You want to know who to give to? There's some great organizations and causes here. Can Share, the Backpack Program, and Food Free and others. Go for it. And be political. See you next week.